I'm a practicing dermatologist based in Ranchi, practicing for past 5 years. I have my own clinic called Twacha Skin, Hair and Aesthetic Clinic here in Ranchi itself. So today I would like to thank Baby Chakra for giving me this opportunity for a live session to interact with you all and to help you solve all your queries regarding pregnancy and children related any skin disorders. So I'll just give you a brief introduction of what we usually see in pregnant women and children, the common things which we come across every day. And then you can put up your questions, your doubts, whatever you want to clear it up. So there can be various kind of skin involvements in pregnancy. Pregnancy is a physiological condition. So most of the skin changes which occur in pregnancy are physiological itself. The major ones which we commonly see are like pigmentation. You can see pigmentary changes on your face like melasma. There can be pigmentation on the neck, underarms can become dark. You tend to see a line on your abdomen which is called as linea nigra. Most of these pigmentation disappears once you deliver. Melasma can stay with you for a time being, but then yeah, it reduces. Other thing which is most commonly seen in pregnancy is the stretch marks. So stretch marks comes in 98 to 99% of the females get it. Just to reduce it, you can use very good moisturizers, you can use very mild body washes, and make sure you don't let your skin be dry or flaky at that point of time. Because of excessive dryness of skin, we also see in some cases there is extreme itchiness of the body, which can be controlled with using good emollients, moisturizers, some antihistamines orally, and taking good care of your skin. Moreover, because of some hormonal changes, usually some women who have acne prone skin tend to have increased breakouts, which can be managed. Always consult your dermatologist because usually the creams which contain adapalene is given by a dermatologist to a regular patient. You can take it over the counter, but it's highly contraindicated if you are pregnant. So topical retinoids should be avoided. Moreover, your daily skincare regimen changes a lot when you are pregnant. The sunscreen which you use should be a physical blocker. If you're using AHA, BHA combination serums or anything like that, AHAs are safe, but BHAs are not very safe. Vitamin C can be continued, but retinols, which is usually used for anti-aging, should be stopped. So retinol can be replaced with either peptide-based serums, or it can be replaced with a natural kind of a retinol called as bakuchiol. So these things can be shuffled up. So always make sure, even if you don't have any skin changes, you have a look at the regular products which you're using. Coming to pathological conditions, we see good amount of sometimes rash, like urticarial rash on your body in case of pregnancy, which usually starts in third trimester. It resolves after you deliver the baby. Sometimes you can women complain of itchiness in palms and soles, which is cholestasis of pregnancy. So that also has to be rectified with some of the medications. Moreover, some skin infections are very common in pregnancy, so because of low immunity. So be very careful. In case you develop any skin infection, always consult your dermatologist for it. Coming to children, skin care in children is again very important. It's not always a good idea to use the same products for you and your babies. Babies always have a very soft skin and delicate, sensitive skin. So we have to take care of what we do to their skin. When babies are born, they have a very dry skin because they are in amniotic fluid. So you need to use very good moisturizers, oils, especially the virgin coconut oil is very good for babies. Naturally, the newborns, you can see them developing few acne like lesions called as neonatal acne, cradle cap development, shedding of hair. All these things are very common in newborn babies. Moreover, as they grow, we tend to see quite a few infections once babies start going to school. So infections can be viral, it can be bacterial, it can be fungal, or it can be because of any infestations like scabies, mite. In viral, we see molluscum very commonly, we see warts very commonly. Impetigo is very common in children. Fungal infections, especially the tinea infection of the scalp, is very common in children. Other than this, allergic conditions like atopic dermatitis is very commonly seen in children. And moreover, we also tend to see some autoimmune conditions, though rarely at a very young age, but they are presentable in the form of blisters, scaly rashes. It can be present at white patches. So don't get scared if you see any of these things. All of them can be treated, and I'm here to answer any queries if you have regarding any of these things. So here I have a question which says, "Hello doctor, can you help me with stretch marks?" See, if you have already delivered, stretch marks don't go completely. But in the initial days, you can always use very good moisturizer. Post delivery, you can use cream containing retinoic acid, retinols, as well as glycolic acid creams, which increase the collagen induction. Moreover, approximately 3 months post your delivery, you can go with procedures like microneedling RF, PRP, fractional CO2 lasers. All these things help in collagen induction and reduces your stretch marks to an extent. Per session, you can approximately see 10 to 20% of reduction, but not more than that in one session. So you have to undergo multiple sessions apart from using the home care regimen, which will be given to you by your treating doctor. The next question that is here is, my 7-year-old experiences rash and blisters in thigh area. What could be the reason and how do I manage it? Usually, thigh area rash is fungal infection, ringworm. The most common cause is that. That has to be tackled. First thing is you have to know the source. Usually, family members are also infected. The child gets from one of the family members, so that has to be traced. If not, then the child has to be treated completely. And the most important precautions that has to be taken in these cases, the child should wear cotton clothes. If possible, child should bathe twice a day. All the undergarments should be washed, sun-dried, and ironed before the child wears them, and that area should be kept completely dry. In case of sweating, you can use some antifungal dusting powders. For the treatment, you have to give some antifungal creams. If required, we give oral tablets also. So, according to the age and weight of the baby, we can prescribe the medicines if required. Another question is, can acne and pimples during pregnancy be result of medicines or supplements, and can I? It's usually because of change in your diet, change in your hormonal profile during pregnancy. Acne can be controlled with your diet, it can be controlled with your lifestyle, but we need to treat it. Then again, in acne, every medicine which a normal person with acne uses is not safe to use during pregnancy. We cannot use antibiotics containing doxycycline. We cannot use adapalene-based creams. The safe ones are uh, azelaic acid is very safe in pregnancy, so we use that most of the cases. And orally, azithromycin can be given, but always consider your dermatologist and gynecologist together when you are taking any medicine during pregnancy. Uh, Another question is, what do pregnancy rashes look like? See, there can be a lot of rashes which can present during pregnancy. Rashes can be allergic, rashes can be infective, rashes can be autoimmune. So, if we see infective rashes, the most common is fungal infection, where you see the ring-like lesions on your skin. Sometimes you get viral infections during pregnancy, where you get a rash on your back, which is called pityriasis rosea. You see urticarial-like lesions in your hand, feet, and whole body in third trimester. That is called as pruritic urticarial papules of pregnancy, which is called as PUP. It reduces once you deliver the baby. So it's a very non-specific way to tell what kind of rash. There can be any kind of rash depending on the specificity of the rash. It can always be treated. How can I treat the skin infection in pregnancy? Again, it depends what kind of infection it is. It's a bacterial, or it's a viral, or it's a fungal. Depending on your type of infection, we can treat it topically with some ointments. Some oral drugs are safe in pregnancy. So depending on the cause, we have to treat it. There's another question. My 4-year-old experiences flaky skin and dryness on his leg and neck area. So usually flaky skin, 4-year-old. is atopic dermatitis. Atopic dermatitis is very, very common in children. It's more common if we see in urban population where we are more concerned and more protective towards our children. We keep them over hygienically. We don't let dust, dirt, anything come near them. So one thing to protect your child from preventing of having atopic dermatitis, you have to let go of few things when they are babies. You have to leave them, and you have to allow them to come in contact with various allergens around them so that they don't get sensitivity towards them. Their body gets used to those allergens. Atopic dermatitis, if the baby develops, the most important thing is moisturizing. You have to use a very good moisturizer at least 2 to 3 times a day. Instead of soaps, use scented bars or mild liquid cleansers to clean their body. Don't use soap or cleansers every day. Make it twice or thrice a week. And it should be you should make sure that the babies don't spend a lot of time in water. Another good way to reduce the rash of atopic dermatitis is using humidifiers in your room. Moreover, if the rash is quite a bit, we give some steroid creams and some oral medications to help you relieve them. And some antihistamines also help in reduction of itching during the rash. So another question is, I experience redness and itching in my hands during 6 months of pregnancy. How do I treat it? Usually, itching in hands is a sign of cholestasis, which occurs during pregnancy because of increased level of bile acids. So you have to consult your gynecologist, but it's asymptomatic. You don't see a rash usually. If the rash is present, it can just be a normal urticaria which you are having during the pregnancy. So you need to get your profile done once, meet your gynecologist or a dermatologist. And if it's just a rash, it can be treated with antihistaminics or anti-allergics. And if it's something which is related to your cholestasis, we have to treat with some other medications. Another question is, my 2-year-old has developed red boils on the back of the neck, and how can I treat it? Red boils back of the neck can be an insect bite because it's an exposed part. Moreover, sometimes because of dandruff in the scalp, you can develop these red boils. So the most important thing is to know the cause of this. If the kid has a lice infestation, then again, because of that, you can have boils on your neck and then back. So mostly back area, we have to check out the reason for it. If it is a fungal infection, also sometimes can lead to boils or rashes on your back. So depending on the cause is how we go about the treatment. So it's very difficult to say without looking at what kind of boils they are. My child has a lot of mosquito bites and skin gets too much red. What to do, doctor? Mosquito bite allergy is very, very common in children, usually seen in exposed parts, that is the hands and legs. Best way is to protect them from mosquitoes, especially during this time, the rainy season. You have to make them wear full sleeves. You can use those mosquito repellent patches on their clothes or the roll-ons which come. In older children, Odomos is also very safe. You can apply them whenever they are stepping outdoors. If the rash has already occurred, if it is itchy, we give some anti-allergic syrups or drops depending on the age. We give some soothing lotions which contain aloe vera, calamine, Premoxin, all these things, so that it soothes the itchiness. If it's quite a bit, we go for some topical steroid application for a very short duration, which reduces the allergic component of it. So basic protection is using mosquito net, full sleeves clothes, and mosquito repellents. Another thing is, as you know, that now hand, foot, mouth disease are going on skin. The black slot, the black spot remains. What do we do? There are a lot of depigmenting creams available for black spots, but as far as kids are considered, only a good sunscreen, which is zinc oxide based, should be enough because that's the safest which kids can use. Moreover, if they're quite a bit, and if the child is above 4 to 5 years of age, you can go for kojic acid like base preparations, and you can apply them overnight. It takes 2 to 3 months, but then yeah, automatically also it will disappear only with the use of sunscreen. The takeaway message for pregnant women and kids today is, in pregnancy, don't go overboard in your skincare. Try to use minimum ingredients. minimum basic regimen. Don't ignore any skin infection if you develop any, because it increases quite rapidly because of the reduced immune system. And make sure you use a good moisturizer 2 to 3 times a day, especially in your belly, to reduce stretch marks development. They will occur, but the intensity will be less if you take care from the day one of your pregnancy. And for children, again, be careful of whatever we are using on on our children. It has to be very mild. Don't use Dettol's and Lifebuoy as it's shown and very commonly used. Those thing increases the dryness. It's just for hand wash. It's not for a body wash. So make sure you use a very mild soap, mild moisturizer for your baby every day. If they develop any itchy lesion, any painful lesion, it should be brought to the notice of doctor immediately and be treated. Don't try to use home remedies for any skin lesions for children, because they lead to contact dermatitis, which further complicates the situation. So you can always consider taking an advice from anyone. You can take an advice from me also. So that's it for today, and I hope it was helpful. If you have anything else, we can discuss. So thank you everyone for joining us today, and we are ending the session.